Doctor, not to take a lot of time, today as you can look at Medical Minds, we are going to look at infertility. Yes, infertility is something that everybody has been waiting for. They want to hear what causes it, what are the treatments, why is it so common these days. But before we go into details, Kylie, in your own word as a medical personnel, describe what infertility is.
Yeah, it's a very good starting question because we have to understand what we are talking about. So we talk about infertility when a couple, that's a man and a woman, have been trying to conceive and they are failing to conceive in 12 complete months. That means
that is 1 full year.
1 full year. That means they have been trying, which means they are staying together. They are having sexual intercourse on a regular basis. Regularity is defined as at least 3 times in a week.
Okay.
So if we verify all those situations and after 1 full year of trying, and they are not using family planning,
true.
they are not yet able to conceive, then we say they have infertility. Remember, I'm talking about a couple.
A couple living and staying together.
Yes, so infertility should be defined for a couple, not for one person.
Okay.
Yes.
Thank you so much, Doctor. In your own words, so infertility in brief is the ability to fail to reproduce.
Yes, the inability to get a pregnancy in a period of 1 year of trial when they are not using any family planning methods.
Thank you so much,
Yep.
Doctor. Let's look at it in this way. Where does the infertility rate lies mostly? Is it in men or women?
Yes. So surprisingly, when we will be discussing about the causes, these are distributed equally in both sexes. We'll be discussing that. It is, I think, the influence of our culture to have us perceive that infertility is more in women than in men.
Okay.
That's not completely true. That's not completely true.
Okay.
Yeah. So, and in our population, we actually have a very high prevalence of infertility. The evidence we have from the preliminary assessments is that nearly about maybe 20 or 30% of our population suffers delay to conceive or delay to achieve a pregnancy in some way.
Okay.
So, which is about 2 to 3 couples out of 10. So, if you move on a particular day and you attended like 10 wedding parties, yes, about 2 or 3 of those couples will be having challenges of conceiving in the next 1 year.
I understand.
Yes.
What could be the possible causes of infertility, especially in young couples? At least we know when someone is grown, their years have gone, but in the young generation, what could be the common factors actually, the common causes contributing towards infertility?
So when we assess couples who come to visit us with infertility, we actually find out that in about 30% of them, the problem is a tube problem.
Tube, that is in women? In women.
Okay. So in about 30% of the cases, it is the tubes which are usually blocked. And in about another 30%, the problem is the sperms. There's a problem with the sperms. Either sperms are too few or they have some abnormality. And then another about 10%, the problem is in both the sperm and the tubes have issues. Yes. And in some cases, we find the issue is the womb. The womb, for some reason, either is scarred or has some issues which makes the pregnancy not to be sustainable.
Okay.
Yes, but in some percentage, like about 10%, we find you can't find a reason. You do all the tests and everything is normal, yes. So we say it is unexplained.
Okay. Doctor, before we go so far, what causes those blocked tubes in women especially, the scars and because at times someone says I have blocked tubes.
Blockage of blockage of tubes. In our population, the commonest cause is usually infections. The commonest causes are usually infections.
What type of infections are those?
Infections into the tubes come commonly because of miscarriages, abortions. People have pregnancies which they don't want, and then they go ahead and they remove their pregnancy. And then they get infections after that.
Okay.
Lately, we are beginning to see some cases of endometriosis causing blockage of tubes. Also, that is one of the causes. But also, some people still get STDs in our population. We still have gonorrhea, we have still chlamydia in our population.
So, STDs cause blockages of tubes, even after treating?
Yeah, because most cases of STDs, for some reason, people present late.
Oh,
yeah, they present late.
By the time they're discovering it has
yes, it has already caused some damages. Because you see, sexual transmitted diseases, they have some bit of stigma. People don't openly come out,
True.
And so it shows that maybe they have had some sexual issues, and then they are coming up with this infection, and so they delay to come for treatment. Yeah.
I understand. Let's talk about the low sperm count.
Yes.
Especially in men. What causes that?
The low sperm count. Yeah, so the low sperm count, as I told you, in our population, about among our couple who come for treatment, about 30% of them have issues with sperm. Yes. Now, the low sperm count, in some cases, we're able to identify the cause, the underlying cause. In some cases, we're not able to identify. We just look at risk factors. But common things which show up is that some men have had viral infections in early childhood.
Okay.
There are some viruses which destroy the testes.
When a child is still young?
Yes, commonest to be mentioned is mumps, and that's why it was a very good idea to really promote vaccination against mumps. It's now among the things we vaccinate against. But people used to get a lot of mumps. It is a mild infection, but later in future, it shows as low sperm count because the viruses go and destroy the sperms.
That is in the male child?
In the male child.